afternoon everybody, and a warm welcome to our third homeopathic session. I am Dr. Ayeesha at Clover Medical Center, a homeopathic physician from Dr. Batra's Medical Center. Today I will be speaking to you all about hair loss in men. Yes, just as we women have complaints of hair loss and are very much concerned about our appearance, similarly even men do complain of hair loss and they are also very much concerned about it. We have patients frequently visiting our clinic with a complaint of hair loss, and they are eager to know if we can do anything to control the hair loss. There are different types of hair loss and different reasons for hair loss. Today, as I speak about hair loss in men, I will be covering a few common types of hair loss seen in men and the reasons and what homeopathic medicines can do. The most common type of hair loss seen in men is a male pattern balding. Male pattern balding is, in medical terms, is known as androgenic alopecia, and the most common cause for this is hereditary. That is, the person inherits the sensitivity to the dihydrotestosterone hormone. So, if this is the hair follicle, at the beginning it's very thick, the hair follicle is thick and it gives rise to a thick hair. But under the influence of a dihydrotestosterone hormone which is there in the body, it tends to thin out. So as the growth cycle of each hair occurs, it tends to thin out in each growth cycle and becoming a very thin hair, and even the color fades. So one of the reasons definitely is a genetic factor. Other reasons which we see is certain medical conditions like thyroid hormone, like thyroid disorder, or anemia, or that is low hemoglobin level. Hair loss can even be seen due to side effects of certain medication. In male pattern balding, what happens is basically men usually start complaining of a receding hairline at the temples and at the frontal area. So this is the various stages of hair loss in men. So at the starting, what happens is there is a receding of hairline over here at the temple area and at the center. Gradually, this hairline tends to recede and the density of the hair will reduce at the crown area. So men usually start complaining of a loss of density in this part of the area, or a very thin hair are seen, the scalp starts getting visible. And hence it tends to progress, developing a bald patch maybe at the behind, and this patch tends to increase in size, gradually covering up the whole scalp. And as you all can see, it's mainly the side and the top of the head that is affected. The side hair and the behind hair usually remain unaltered in most of the patients. These are the stages of balding, and what studies show is that you tend to progress from one stage to another in a period of 1 year. But of course, if there is a very strong family history of male pattern balding, or there's a lot of stress, or the nutrition is not good, definitely the rate of progress to each stage is at a faster rate. We usually diagnose this condition by just observing the patient when the patient comes to the clinic. So by the appearance of the hair loss, and even by a microscopic examination that we do. So we have a video microscopic instrument which is a very painless procedure. It helps to magnify your scalp to nearly 200 times. So by the magnification, what we understand is your density of your hair, the number of hair strands on your scalp condition, and the condition of your hair. After the examination, after a detailed medical history, we do conclude that this patient suffers from male pattern balding. Homeopathic medicines definitely have a lot of scope in this kind of balding. What homeopathic medicines basically do is we try to strengthen the hair follicles and reducing the sensitivity of the hair follicles to the hormone dihydrotestosterone. It also treats the underlying causes of say if a patient has a thyroid disorder or the patient is suffering from anemia. So it takes care of these disorders to improve the hair quality and the hair fall. At Dr. Batra's clinic, we do have a aesthetic treatment known as hair vitalizing treatment. It's basically, we place the scalp on the patient's head, which releases a very low density laser and light. What happens is with this laser, the follicles would tend to expand, and we put a solution on the scalp which will soak in the solution. After this therapy, patients do notice a considerable difference in the number of hair falling. They also notice that the hair has improved, its vitality improves, and after around 5 sessions, definitely the thickness also improves of the hair. Based upon the stages of the hair fall, the program is selected. It's a 20-minute session. Usually we tell our patients to take a minimum of 10 sessions for best results, along with homeopathic medicines. Because as this is just an aesthetic treatment, it's an external treatment, but the homeopathic medicines will deal with the more underlying cause, and definitely it will give better results. Another type of hair loss that we see is basically known as alopecia areata. Now, alopecia areata is basically an autoimmune condition. Autoimmune condition means that your own immune system or your self-defense mechanism of your body thinks that your own hair cells or your own hair follicles are a foreign body. So it will tend to attack it. So patients complain of patchy hair loss on the scalp or the beard area or the mustache area, or sometimes even on the eyebrows. Hair loss can even be seen in patches on the body. It's an autoimmune condition, more than a cosmetic problem. Definitely it is a medical condition. Some men who have thyroid disorders, they also have alopecia areata. So you start losing hair in patches, and it can occur suddenly or over a short span of time. Another reason for alopecia areata is stress. So under tremendous stress, some patients can also develop alopecia areata. The good thing of this condition is that the hair follicles are not harmed. So the hair follicles are not thinned out, or they don't close down. So with the right kind of treatment, all the hair can be grown back. So that's the best part. That's a silver lining for this condition. Patients having alopecia areata also undergo a lot of emotional and psychosocial stress, because at times the patches are very evident on the scalp or on the beard area or on the eyebrows. So they would tend to withdraw themselves from social gathering, or they will not really be very open to meet people. Homeopathic treatment definitely offers excellent result in such conditions, in autoimmune illnesses. Homeopathy is very safe, it's very gentle. We take a complete history of the patient. Each patient is treated as an individual. We see the stress factors, how the patient is reacting to the stress factors, and then the homeopathic medicine is given. So the homeopathic medicine will basically work on the immunity of the patient. It will promote regrowth of hair in the patches, and at the same time it will try to reduce the occurrence of new patches, because at times we see that the old patches start filling up, but then there is an appearance of a new patch in another area. So it's very important that the appearance of new patches have to be arrested. Then we know that the disease is arrested. So these are a few conditions that we see in men, and definitely homeopathy has a lot of scope in treating hair loss. I'll be taking a few questions about what have been put down. I have noticed hair fall after a lot of stress. Is hair fall related to stress? Yes, one of the reasons for hair fall is stress. So people who undergoing a lot of stress, they notice their hair falling and excessive hair fall. It might not only be emotional stress, but it can even be physical stress. That means if you undergo a crash diet, you cut down suddenly on your proteins, on your carb intake, so you're putting your body through a stress. So then also you will complain of hair fall. Emotional stress definitely is one cause for hair fall. And again, along with a right kind of treatment, homeopathic medicines can of course control your hair fall. It can also alter the way your body is reacting to this kind of a stress, or the way your hair follicles are reacting to this kind of stress. Next question is, I am losing hair on the top. Can my hair regrow? I'm considering that this is a hair on the top means a male pattern balding. So in male pattern balding case, there is a lot of thinning and falling of the hair from this part of the scalp. So in terms of regrowth, it completely depends on a few factors. It can be reversed but not completely. So that means is, if a patient is at probably this stage of balding, I definitely can't get back to the first stage, but definitely what we can do through homeopathic medicines is maintain and stabilize a patient at this stage. At times it can be reversed to a certain extent, but it depends upon factors like the age of the patients or the underlying medical condition of the patient. So a complete history and a hair examination will only help me understand how much I can help this patient. The next question is, I am losing hair in patches. I have noticed that some patches fill up while new ones appear. Do I need treatment? Yes, definitely. You definitely need treatment. This seems like a case of alopecia areata, where the patient is saying that he's losing hair in patches while they are filling up, but he's also getting new patches. So as I said, this shows that the disease is not controlled, but it is progressing. So the disease, it's active. The autoimmune condition is very active in the body. So with the right kind of homeopathic medicine, with a detailed history taking, again we can arrest the progress of the disease. We can promote regrowth in the patches and avoid new patches coming. A study done at Dr. Batra's also shows that a relapse seen in when patients use other kind of medication, like say some steroidal treatment, is more, the chance of relapse is more in those patients than compared to patients who use homeopathic treatment. I have noticed excessive hair fall after coming to Dubai. Can hair loss be linked to the water? Yes, I see a lot of patients complaining that once they have relocated to Dubai, they complain of excessive hair loss. Definitely water is a contributing factor for hair loss. So patients usually would, you get filters to be attached to the tap, or they would have bath with mineral water. This changes do help to a certain extent, but at the same time, it is not the only reason for your hair fall. There might be other contributing factors, as I said before, maybe some hereditary reason or some other medical condition. So along with water, definitely the other contributing factors have to be learned. We have to see what are those other contributing factors for your hair loss, and then treat those factors accordingly for better results. Any diet to be followed for good hair? Diet along with medicines play a very important role in good hair growth or in minimizing the balding. A diet basically rich in iron, rich in protein is recommended for patients. So we usually tell them to take a protein-rich diet, so a lot of soya or a lot of eggs in their diet. Dry fruits, fresh vegetables are advised for patients. Also, they can include flax seeds and green tea regularly in their diet. The next question. I was treated for my alopecia areata with steroids, which worked for some time, but the patches have reappeared. What can I do? Yeah, so as I mentioned before, that The relapse of alopecia areata does happen at times under extreme stressful conditions. There is a higher rate of relapse when steroidal treatments are used than compared to homeopathic treatment. So definitely you can come over to the clinic, you can book an appointment, come to the clinic, and after an examination and detailed history taking, we can start homeopathic treatment for you. And homeopathic treatment will definitely bring down the possibility of relapse of these patches again. The next question. I have a lot of dandruff. Can this be a reason for hair loss? Yes, dandruff, or in medical terms what we call as seborrheic dermatitis, is a condition of the scalp. So patients would basically complain of the scalp getting very itchy, and on examination we see a lot of flakiness, a lot of scaling occurring. So this means that the scalp is not very healthy, and of course it does affect the hair roots, leading to hair fall. So along with anti-dandruff shampoo, or along with the hair care, definitely homeopathic medicines will help, because an anti-dandruff shampoo will only give a temporary result, but what we need to take care is that this does not occur. So homeopathic medicines have a very good results in controlling seborrheic dermatitis, and of course it controls the hair fall. Is oiling of hair daily good? The frequency of applying oil for your hair depends on your scalp condition. So for some people who have a very oily scalp, we really don't advise them to oil their hair on a regular basis. People who do have a dry scalp are fine, they are advised to oil their hair. And oiling basically helps only in moisturizing the scalp and improving, it helps to soften the hair and to moisturize the scalp, but it really does not help in preventing of hair loss or in hair growth. So we, as I said, that we have a examination done at the clinic where we have a magnifying microscope, and it helps us to understand the condition of the scalp, and accordingly advice is given to the care that has to be given to the scalp. How does homeopathy differ from the other medicines for hair fall available in the market? Fine. So the other medicines that are available in the market have definitely a few side effects. If you use it for a long time, there are side effects, and there are some patients who they use these medications, and when they stop using these medications, they come down with excessive hair fall. Patients come to our clinic giving such a history that they started using this medicine for hair fall, and they stopped it, they completed the course, but then after that the hair fall increased to a great extent. So along with a few side effects, this happens when you use other medication. Homeopathic medicine definitely have no side effects. They are very gentle on the body, and as I said, it's basically treating the underlying cause. So it's helping your hair follicles to become stronger. It reduces the sensitivity to the THT hormone, and it also treats the underlying cause. So it's not just an external application that we are giving. We don't usually give external applications. It's more medicines that are to be taken internally, because the cause is underlying, which has to be taken care of. What shampoo or oil would you recommend to prevent hair fall? Any mild shampoo is usually what we recommend our patients. So a mild shampoo means a shampoo which does not have a lot of chemicals. It's more herbal based, is recommended for a hair wash. That's basically to keep the scalp clean. Oiling, as I said, depends upon your scalp condition, whether it's a dry scalp or oily scalp, and then you can use any oil which you feel best for you. As I mentioned before, it really doesn't help in preventing hair fall, because these are only external applications, but what definitely would prevent hair fall is knowing the right reason for your hair fall and correcting those reasons. So with this, we end today's session. We'll be having another session in 2 weeks, and that would be on hair loss in women. So please do check the Clover Facebook page to know the date and the time for the next session. Also, if you all want to have a free hair examination, you all can call the clinic number which is given, and you all can take an appointment for a free hair examination. So once the examination is done, or if you all do have complaints or concern about your hair, I can definitely guide you all on the reasons for your hair loss, for your scalp condition, and suggest the best treatment plan for you. Till then, bye and take care.